good afternoon. I'm Zafir and I'll be your fitness trainer for today. And you must be Aidin, right?
Yes.
Okay. So before we start any exercises, I'll be conducting a ACSM exercise pre-participation screening. So the goals of this pre-participation screening is basically to identify individuals which is you, to whether check you should receive any medical clearance before starting any exercises. Or another thing is whether you check if whether you have any significant diseases who should participate in any medically supervised exercise programs. Also, last one would be like if medical conditions requiring any exclusions from exercise programs until conditions abate or are better controlled. Okay. So next one, there'll be 5 steps we'll be going through for this ACSM pre-participation screening, and I'll go through you step by step. Right?
Yep.
So basically, the first step is more to asking you some this question, which is we have PARQ. So this PARQ is more to ask you questions when you check for any diseases, check for any symptoms you have to make sure you're clear for exercise. Okay. So before I start asking you the questions, do you have your consent in terms of asking you any questions related to?
Yeah, sure.
Alright. So first of all, first question for this PARQ we have. So has your doctor ever said that you have heart conditions or high blood pressure?
No.
No. Right, that's good. So do you feel any pain in your chest at the rest during your holiday activities or when you do any physical activity?
No.
No. Right. So next one, do you lose any balance because of dizziness or have you lost consciousness in the last 12 months?
No.
No. Okay. Have you ever been diagnosed with another chronic medical condition other than heart diseases or high blood pressure?
No.
No. Okay. Are you currently taking any prescribed medications for chronic medical condition?
No.
No. Yeah. Next one. Do you currently have had within the past 12 months a bone or soft tissue or joint or muscle, ligament or tendon problem that could be made worse by becoming more physically active?
Yes.
Yes. Okay. So next one will be last one. Has your doctor ever said that you should only do medically supervised physical activity?
Yes, have.
Alright, thanks. So that will be all. So since you have answered 2 questions yes, so we'll move on to the following part, which is just to follow up questions about your medical conditions.
Sure.
Okay. So first one will be, do you have any arthritis, osteoporosis or back problem?
No.
Okay, good. So do you have any difficulty controlling your condition with medication or other physician prescribed therapies?
No.
No. Okay. So do you have any joint problems causing pains, recent fracture or fracture caused by osteoporosis or cancer, displaced vertebrae?
No.
No. Okay. Have you have steroid injections or taken steroid tablets regularly for more than 3 months?
Never.
Okay, no. So next part will be, do you currently have any cancer of any kind?
No.
No. Okay. Next one, do you have a heart condition or cardiovascular condition? This includes such as a coronary artery disease, heart failure, diagnosed abnormality or heart rhythm?
No.
No. Okay. Next one will be, do you currently have any high blood pressure?
No.
No. Okay, last one will be, do you have any metabolic conditions? This include type 1 diabetes, type 2 diabetes and pre-diabetes?
No.
No. Right? That's good. Okay, do you have any mental health problems or learning difficulties?
No.
No. Okay. Do you have any respiratory disease such as chronic obstructive pulmonary disease, asthma or any high blood pressure?
No.
No. Okay. Okay, do you have any spinal cord injuries such as tetraplegia or paraplegia?
No.
No. Okay, last one is second last will be, do you have any strokes?
Never.
Okay. Last one will be, do you have any other medical condition not listed above, or do you have 2 or more medical conditions?
No.
No. Alright, that's good. So do you answer all no for the second part, so this is good. Okay, right now we're gonna move to the second steps. Basically, second step what we're gonna do, I'm gonna check for any specific diseases you have. Okay. So first of all is, do you have any known cardiovascular, metabolic or renal diseases for cardiovascular such as the cardiac, peripheral vascular or cerebrovascular diseases?
No.
No. Okay, do you have any metabolic diseases?
No.
No. Last one will be, do you have any renal diseases?
No.
Okay, that's good. So that's the second step. So we're going to move on to the step 3, which is basically going to check for any of your signs and symptoms. So do you have any signs and symptoms underlying for cardiovascular, medical, metabolic and renal disease? Okay, such as firstly, do you have any pain or discomfort in chest?
Never.
No. Do you feel any shortness of breath at the rest or with one mild exertion?
No.
Okay. Do you feel any dizziness or syncope?
No.
Okay, that's good. Okay, now we're going to move on to the step 4. Okay, so since we're going to do some exercises for this assessment, I'm going to check with you like how hard do you hope for your exercises. We have the light followed by moderate and vigorous intensity.
I think it will be light to moderate.
Light to moderate exercise.
Yeah.
Okay, then quick. Right. So for last step what we're going to do is I'm going to check for against the ACSM pre-participation screening algorithm. So first of all, do you participate any exercise regularly?
Kind of three times a week.
3 times. Okay. So based on the algorithm I'm looking at, so firstly you don't have any cardiovascular, no metabolic or renal diseases, and also you don't have any sign or symptoms of any of these part of diseases.
Yeah.
Okay. So from this looking at the algorithm, your medical clearance is not necessary, so which is good. So next one will be for exercises, right? We're going to do it recommended based on algorithm is you start from light to moderate intensity exercise recommend, and from there onwards you can gradually progress to vigorous and the intensity exercise following based on the ACSM guidelines.
Okay.
Right, that's good. So yeah, that'll be all for our pre-participation screening, and thank you for answering the questions all truthfully.
Yeah.
Alright, that'll be all. Thank you, Edin.
Thank you.